Hello, my name is Laura Wilson. I'm a trainee nurse practitioner working within a fertility clinic, and I am currently studying at a level 7 to gain competency in fertility and early pregnancy ultrasound scanning. This presentation will discuss how an advanced nurse practitioner, A&P, within the fertility service can affect patient care using three-dimensional ultrasound scanning. Ultrasound scans are routinely used to monitor and track women's progress through fertility treatment. Previously, this would have been completed by doctors and radiologists. With A&Ps in this advanced role, undertaking the ultrasound scan, they will monitor the follicles on the ovaries and the thickness of the endometrium to assess the progress and plan the next step in patient care using the two-dimensional ultrasound scans. With the emergence of three-dimensional ultrasound in fertility treatment, through the continuing development of ultrasound technologies that have improved within the last 10 years. This relatively new technique allows for more accurate scans, ensuring the patient receives the correct treatment. However, this is not routinely used within the NHS. NICE guidance discuss the full care for a patient undergoing fertility treatment and recognise that ultrasound is an integral part of assessing the patient through medicated sedation, egg collection, embryo transfer or insemination, as it improves pregnancy rates. They also acknowledge the benefits of ultrasound scans in diagnosis of infertility, such as tubular occlusion, using hysterosalpingo contrast ultrasonography as an effective alternative to hysterosalpingography. NICE also state ultrasound scans should be used to identify intrauterine or ectopic pregnancies and miscarriage. Depending on gestational age, they will suggest performing transvaginal or transabdominal scans. Throughout the guidance, NICE state that ultrasound scans need to be performed and monitored by a trained individual with a postgraduate qualification in medical ultrasound that has been accredited by the Consortium of Accreditation of Sonographic Education, CASE. This is echoed by the RCN, BMUS, and the RCOR. However, it is not discussed whether 2D or 3D ultrasound offers better diagnosis, despite studies, such as Gregor and Mayer, supporting the use of 3D ultrasound scanning as a gold standard in care. The RCN recognise A&Ps as an integral and essential part of fertility nursing practice. This includes understanding the socio-economic and political dimensions to delivering care in contemporary settings and environments, as well as advocating for individual needs and ensuring services meet the needs of those seeking fertility care. The RCN name ultrasound scanning as one of their competency framework for career progression in fertility nursing, as seen in the diagram on the slide, though it is part of a greater whole. A&Ps embodying these pathways enable clinics to be more nurse-led and offer holistic care that extends from initial investigation to early pregnancy and end-of-treatment management. The RCN state that advanced nurse practitioners need to have the basic knowledge described on the slide. All registrants need to be competent and confident to carry out any activity that expands their scope of practice, and under no circumstances should they undertake a procedure unless competent to do so. But as in the NICE guidance, 3D ultrasound scanning is not discussed. This may indicate that they need to review current research and issue up-to-date guidance. The British Medical Ultrasound Society produced the guiding principle for radiation safety, as low as reasonably achievable, known as the ALARA principle, meaning if the scan has no direct benefit and if it is a minimal exposure, it should not be undertaken. In the 2017 publication, the Royal College of Radiologists warned that those who provide ultrasound services are ethically and legally vulnerable if they have not been adequately educated for the role. They caution that nurses learning the scanning technique of a specific anatomy risk misinterpreting other issues. However, they have not acknowledged the benefits of having an advanced nurse practitioner in this role. For example, the A&P can discuss and explain the outcome with the patient that a sonographer may not feel they are able to provide. Unlike with the NICE and RCN guidance, the RCOR have acknowledged the move to perform 3D and 4D ultrasound scans earlier in pregnancy. The 3D ultrasound allows for a rapid acquisition of volume for later offline analysis and may in fact be associated with lower exposure time. although they do not recommend the use of ultrasound such as 4D imaging for the sole purpose of souvenir images or video recordings in the embryonic period. Advanced nurse practitioners are educated at a master's level and are assessed as competent in practice, gaining expert knowledge and skills. They have the freedom and authority to act and make autonomous decisions in the assessment, diagnosis, and treatment of patients. Nursing care in fertility has changed as nurses working in this ever-advancing area are assuming increasing responsibilities. Given time constraints and costs, nurses were trained to undertake the responsibility of scanning patients. The role developed, allowing nurses with ultrasound training to monitor patients and make decisions, as they are cheaper than employing radiologists. The Trust recognises the need for the A&P role, with the expectation that the A&P upholds the 4 pillars of advanced practice, adding the caveat that an A&P is not to replace doctors, rather to support and assist them. In fertility care, specialist registrars are on short placements during their training, therefore A&Ps provide the element of continuity to patient care, as patients will often see the same nurse in subsequent scan appointments. The availability of A&Ps in the day-to-day running of fertility clinics makes care easily accessible for patients, as the A&P can complete and assess the ultrasound scan. Additionally, on completing the ultrasound scan, the A&P can plan the next step in treatment with the patient, ensuring that care is patient-focused. They can discuss their recommendations with other A&Ps without requiring a doctor to attend. It is important to emphasise that complex issues can be discussed with members of the multidisciplinary team. Furthermore, an experienced A&P can enhance MDT working, as in the absence of a doctor they can make clinical decisions in patient care with advice from embryologists. This slide outlines the skills that I have gained through my continuing practice in fertility care. As I started in this area, I felt as though I was newly qualified again, and it was a few months before I felt like I understood the basics in fertility care. Upon commencing my scan training and observing my senior colleagues, I realised there is more to an A&P role than scanning. The sisters assess patient care and ensure the patient understands the implications of treatment. It is this level of expertise I wish to gain, as highlighted in the Benner's stages of clinical competence. Advanced nurse practitioners in the fertility setting are a key aspect of the patient's care, as seen on the slide, and they have other senior responsibilities. In my role as an advanced nurse practitioner, I hope to complete the additional skills outlined on the slide, such as embryo transfers and identifying anomalies on scan. There are further advancements in this role, such as becoming a donor coordinator, which I aspire to become. Follicle tracking is used to assess the response to ovarian stimulation during fertility treatment. In most clinics, two-dimensional transvaginal ultrasound is used to perform and monitor follicle growth. The reliability and validity of such measurements are likely to decrease as the number of follicles increases. With two-dimensional scan, only an approximation of the actual follicular volume is achieved, therefore it cannot be used to define standards of follicle tracking. 3D ultrasound offers accurate evaluation of size and volume of complex structured follicles. Though previous systems have taken longer to process the data, the use of 3D ultrasound in reproductive medicine, combined with automated measurement of follicular size, provides a fast, valid, objective and reliable standard of care, particularly in ovarian hyperstimulation syndrome assessment. 3D ultrasound imaging has proved to be far accurate, as seen on the slide. The use of 3D scanning in follicular assessment would mean that the A&P could scan and assess patients faster, therefore more patients would be seen. They would need to have an understanding of the technology, but the information provided by the scan would allow the A&P to plan safe and appropriate care. Parameters to assess endometrial separativity during reproductive treatment include endometrial thickness, pattern, volume, blood flow, and occasionally Doppler of the uterine arteries. In 3D ultrasound, endometrial thickness and pattern can be precisely assessed, and with 3D power Doppler that can be used to examine the blood supply to the whole endometrium. Although 3D imaging offers more information on the endometrial lining, it is not an accurate prediction of pregnancy, as the embryo quality has a greater part in the outcome. In the evaluation of the endometrium, 3D ultrasound is a promising tool, but the literature does not confirm the suggested benefits of this technique, and in accordance with the ALARA principle, this would not be recommended in current practice. The other drawbacks is that 3D ultrasound probes are expensive, and consequently, NHS fertility clinics may not want to purchase this without clearer benefits in patient care. With other studies researching the use of 3D ultrasound scanning in diagnosis of infertility, have found that identifying artifacts such as endometrial polyps and their specific location was easier to assess. This is becoming a frequently used diagnostic tool in the NHS. During fertility cycles, polyps can often form. 2D ultrasound scans may not identify if the polyp would interfere with the embryo's implantation. The image on the slide demonstrates this, that with the 3D scan it can be seen clearly within the endometrial lining, and in this instance would need to be followed up with further investigations. Conversely, if the polyp can clearly be identified as not in the endometrium using the 3D scan, then the A&P would not need to refer for further investigations, saving the patient's valuable time and NHS resources. As 3D ultrasound scanning has improved in recent years, it has become as safe as 2D ultrasound scanning. The use of 3D scanning in ectopic pregnancies can be accurately characterized, particularly with interstitial ectopic pregnancy featured in the image on the slide. Moreover, in patients with a uterine anomaly such as a septum, 3D ultrasound is useful in evaluation of pregnancy implantation, and using 3D ultrasound in volumetric placental measurement has been proven beneficial in predicting adverse pregnancy outcomes. In recent studies, it has been highlighted that there is a requirement for standardized measurement protocols. Until these and quality assurance protocols are established, it would not be recommended as a standalone clinical or research tool. Although the use of 3D ultrasound would be beneficial in identifying ectopic pregnancies, 2D ultrasounds would still need to be performed first. Though the potential for this innovation could drastically reduce scan time and exposure for the patient, it would enable the A&P to accurately scan and assess the patient to then make an informed decision. Outlined on the slides are the advantages and disadvantages to 3D ultrasound scanning. Though there are issues that need to be addressed, the benefits of 3D ultrasounds in patient care are clear and outweigh the disadvantages. To be able to use 3D ultrasound scanning in future treatments, this action plan must be followed. It is advisable to use 3D ultrasound scanning in follicular tracking, but there is more guidance that needs to be issued by the bodies such as the NICE, RCN and RCOR. The A&P would also need to take further learning to discover how to use the application for 3D in practice, but it's also beneficial for identifying pregnancies in an unknown location. Thank you for listening. Here's a list of my references.